Alrighty, then I'd like to call to order the February 9th, 2021 meeting of the Middleton Board of Selectmen. Meeting here together on Zoom, and this is also streaming live. If we can, then I would like to go to item number 1, which is the reading of the warrant number 2117.
Actually, Mr. Chairman, if you could just read the disclaimer on the top of the agenda, just for the record, so the public knows that they're being recorded.
Oh, I'm sorry. The Middleton Board of Selectmen meeting agenda, Tuesday, February 9th, 2021, 7 p.m. And remind people that this meeting is being recorded.
Thank you.
You're welcome. Sorry about
So
that.
for this week's warrant number 2117, on the payroll side, we have an amount of $711,482. Not much of note in there, other than a small amount of snow removal in the amount of $12,315. That was for the prior storm, not for the most recent events that we had. Down in bills payable, total of $1,081,048. Payroll deductions this week in the amount of $92,327. In accounting, just 2 lines below that, our share of a COVID relief pandemic nurse, that's the Tri-Town nurse that we've hired with CARES Act. That, by the way, is, and Derek may speak to this when he comes on later on, that has been a real godsend to the health directors and to the 3 towns. The woman that we brought in is really doing great work and helping them tremendously with contact tracing and other things when there are exposures in the schools and things like that. She's been doing super work. So certainly a good expenditure on our part. Not a whole lot else of great curiosity in bills payable down under MELD, under the light department, $792,179 in purchase of power. And then at the very bottom, $1,893 in veterans aid that our VSO Gary Bent has pushed out. So CFO Sarah Wood has reviewed the warrant and asks the board's affirmative action.
All right, thank you. And then I'll take a motion to.
I'll move to accept as presented.
Thank you. In a second. Thank you. In a second. Tim, if you would call a vote, please.
Mr. Britakis,
Yes.
Mr. Preston,
Yes.
Mr. Cathiotis,
Yes.
and myself.
Yes. Okay. Motion and warrant accepted unanimously. The second is to accept the minutes of the open session of January 21st and 26th of 2021. I'll take a motion.
Make the motion
Move to
the
accept.
minutes as written.
Thank you. And a second, just to be clear, I think we walked on each other. We get a second?
Second.
Thank you. I think we walked on each other. Okay, Mr. Hooton, please then, another vote.
Mr. Britakis,
Yes.
Mr. Preston,
Yes.
Mr. Cathiotis,
Yes.
and myself vote yes.
All right, motion carries unanimously. Minutes are accepted. Mr. Sheehan with a town administrator update and report.
Thank you, Mr. Chairman. Just a couple of items tonight for the benefit of the public more so than the benefit of the board. Last Saturday on February 6th, we had the first of several joint meetings between the Board of Selectmen and the Finance Committee to discuss the fiscal year 2022 operating budget that starts on July 1. Anyone who did not watch it can catch it online. It'll be on the website and running on cable. Should be up in the next 24 hours or so. And so it's a good opportunity for residents to see how your funds, how your tax dollars are being spent as we develop what will be about a $40 million operating budget for fiscal year 22. The board and the finance committee will meet again in joint session on March 6th, which is another Saturday. and then again on March 25th. That will wrap up most of the budget development discussions. There may be a further meeting beginning of April, but we won't know that until we get a little bit closer to the end of the budget development cycle. In addition to the video of the meeting, there's also a video online of an interview that I did with our CFO, Sarah Wood, describing the budget, where the funds come from, where the funds go, and basically all things, well, what you can explain about an operating budget in 10 or 12 minutes. So, so the response has been real positive to that, and I encourage anybody to take a peek at that too if they haven't seen it already. I wanted to bring the board up to date on a piece of legislation that was passed in the last couple of weeks, the Partnerships for Growth law that was passed in January. There will be some impacts on Middleton, as there will be on pretty much every city and town in Massachusetts. Among the provisions that we're paying attention to are a law that or a provision that allows or requires cities and towns to establish by right zoning for multifamily development. There's a lot still to understand about the law. There's going to be guidance that comes out at some point in the future. It's not out yet, but failure to adopt multifamily zoning by right in a reasonably sized area of a town, city or a town, will make that community ineligible for certain grant programs. So it's certainly within our interest to pay attention to what's required under the law. DHCD, the Department of Housing and Community Development, is charged with developing guidance that will implement this new law. Council advises us not to make any rash decisions. It's going to be a while before those guidelines come out. So we'll wait to see what those look like once that guidance comes out, and what exactly is required. A couple of other pieces of the law that are of interest. Historically, zoning in Massachusetts has required a 2/3 vote to modify zoning. By a 2/3 vote by the legislative body, so in our case, town meeting. There are under this law certain amendments to Chapter 40A, which is the Zoning Act, and those changes will relax that 2/3 majority down to a simple majority for a limited number of land use types. Again, multifamily, accessory dwelling units, or in-law apartments. Certain changes to parking and open space developments. Similar to that in Massachusetts, special permits and variances require a 2/3 vote by the Zoning Board of Appeals, or whichever the permit granting authority is. It's usually the ZBA, and here it's the ZBA. Some of those will also be relaxed down to a simple majority. So instead of needing 4 out of 5, it will be a 3 out of 5 vote, or 3 in the affirmative, I should put it that way. And those are also pertaining to multifamily, open space development, mixed use, and certain parking requirements. So we're awaiting the guidance from DHCD. We don't expect that it's going to come quickly. I wouldn't be surprised if this is something we're talking about 6 months or a year from now, simply because it's a pretty significant change in some respects. So we're not going to rush to implement, but we will keep an eye on things, and I'll keep the board up to speed as we learn more and as things change. And that's all I've got for updates tonight, Mr. Chairman.
Okay, thank you. For item number 2 will be public comment period. It's where we welcome residents to take time out in the top of our meetings to make a public comment of any type. I don't know, Adam, can you tell there, do we have anyone?
It does not look like there's
Right.
like there's anybody waiting for public comment.
Okay. All right, well then, very well then, so we'll move on. Number 3 on the agenda is this discussion of COVID-19 pandemic and vaccinations with our our own Derek Fullerton, Director of Middleton's Public Health.
And
Mr. Fullerton.
Mr. Chairman, if I could jump in just quickly before Derek starts. I've also asked Jillian Smith, our Council on Aging Director,
Okay.
to join us tonight and talk about the Council on Aging end of things and how the COA and the Health Department are overlapping or intersecting in COVID-related things. So thank you, Derek.
Hey, everybody.
Hi.
Hey, Derek.
So I'm here to just answer whatever you guys need to me to answer. You guys invited me, so I'm happy to report anything. I can just start off that the numbers are decreasing daily, which is a good sign. We hadn't had any cases yesterday. We have 1 case today. So in the last 7 days, we were averaging, prior to this weekend, we were averaging about 4 cases a day. And, we're down to the last couple of days only having 1. So that's a good sign. Well, hopefully, I know that was a good sign in Massachusetts for being the lowest amount in a while. So that hopefully is indicative of what we're seeing here in our community. Of the last 7 days prior to yesterday, we had 28 cases in the last 7 days. And out of those 28 cases, 21 were same household. 8 to 9 households having the majority of the cases out of those 28, or 7 other individual cases. So continues to see household transmission as our highest transmission in the community.
Okay.
Related to, you want me to just keep going, or you guys like to ask questions? It's popcorn style, whatever you'd like me to do, or I could just talk about vaccinations, etc.
I'd say you keep going. We'll jump in if we have some questions.
Sure.
We've never been shy.
Hey, Tim. So yes, so no, thankfully that we have the mega site, I use the phrase, it's a big piece of the puzzle. And Middleton has the big piece of puzzle right here in our community. I know people have been using it. We partnered originally with and continue the partnership with the senior center, and I don't want to steal any wind from Jillian, but the Council on Aging has been tremendous partnership. We knew that this phasing in the groups within this phasing would be a bit of technology challenged. So we have partnered with them, and they are been receiving calls and helping registering at the mega site. Simultaneously, we are continuing. We started our homebound seniors over the weekend. Tracy and myself were out in the community doing a list of true homebound seniors that were identified by the Council on Aging. And we had our good things, doing homebounds takes a little bit longer. People have been isolated for a while, so we're not, we don't want to just walk out the door, so we end up staying a little bit longer and talking. So it ended up being a little longer Saturday than we expected. Yesterday, we initiated our 2 more campaigns. We did our congregate care setting, Northeast Arc, Orchard Circle. And then on Friday, we are doing Oak Knoll and Ferncroft Towers. These are not to take away from the mega site. We encourage everybody to go to the large vaccination clinic that are able. It seems to be that small percentage that Jillian and I and others, Tracy, have identified of the fear of going to a site like that, which isn't fearful. We can talk about that, but just don't want to even touch it. Kind of like when we had the stop the spread sites, people wouldn't just go to those; they would wait to find it with their local doctor or that more intimate feeling. So we're telling everybody to go to the large vaccination site, but we're also referring back to that big piece of the puzzle. We're doing our small piece of the puzzle part that we can. So that's as we continue. I had a call today with Boxford and Topsfield. We know there was some, things going on with trying to collaborate. We think we've worked through some things that will help us do some more collaborative efforts on some of the vaccinations down the road. Again, I keep turning around to saying that we are encouraging people to go to the large vaccination site, but we'll still continue our play our part and do our small percentages. We're only getting a small amount of vaccine each week, and we'll continue to put those in the arms of the groups in the phasing that we can. So
Eric,
it's, yes.
I do have a question. Do we have any knowledge of what percentage of our 75 plus are being vaccinated? I mean, does the mega site give you information about Middleton people? Is that a HIPAA thing? Or so do we have any idea at all?
No, I know that DPH released vaccination reports, but it's not specific to each town. No, so I don't know. The only thing I see on, town related is COVID cases through the disease surveillance, but I don't see vaccination related data. I can ask that when we have our weekly DPH calls to find out if that's community specific data we could request or they would be able to supply. But no, I don't have that number.
No, I was
So
just,
what-
I was just more concerned, like, when are they gonna know that the 75s are done? And move on to the next one, if they can't tell you who's been in, who's been out. And I don't know if you, I don't know if Jillian has a list of the 75 plus, but you
Yeah.
know,
That's a great point, Tim. Ultimately, that's why as the health department, we didn't take the answer of the mega site being the only solution. We're just part of it. And Jillian and I spoke specifically knowing that we have, almost 2,000 people from the 65 to 75 and above range combined. There is a number, I think Jillian has it. We went over it about a month ago. But, we expect that, that we're going to try to hit what we can do. And then the rest is, as other avenues open up with the primary cares and then the pharmacies, it's kind of like when flu shot season comes around, you try to get it where you can. And as long as we are trying to get it into the arms of the people that are in those groups, we're playing our part. But I'm not going to have a true answer of how we know everyone's getting it in our community. That's kind of why we want to make sure that we still have little small opportunities when we get vaccine coming into us, that we do it, because we know that, if you go onto the large vaccination site, it's like getting the fast pass at Disney. It's being there at the right hour and the right time and just being able to click and make an appointment. And then there's some challenges about, husband and wife getting it at the same time. So we're just trying to fill that void of the fear and the confusion in our community, and we'll continue to vaccinate. But I don't know when, like statewide, when they make that pivot to like, hey, it's time to go to the next thing, other than the one thing I would say for data collection is every vaccination that goes in isn't like your typical flu season. So when we do typical flu vaccinations, we do it, and then we do paperwork, like true paperwork. And then we submit that. And then, at some point down the road, we get Medicare reimbursements and the state knows, hey, Middleton did 330 doses at this clinic. With every vaccination that goes in the state of Massachusetts, it's going through the state registration link, the state vaccine link. So they do have a percentage that they know specifically statewide. I just don't know if they can give me a townwide data, but they do know, and that's probably how they're going to get that data of saying, all right, we know we have estimated amount of 75 plus in the state of Massachusetts, and we've seen 60% vaccinated. Let's move. That's what I'm guessing.
I'm assuming
Eric,
the Ferncroft at some point would say, hey, listen, we've got no appointments for the next 3 days. We're pretty much hit everybody,
What's that? I'm sorry.
I said, I'm assuming at some point, Ferncroft is gonna report, I'm gonna call it Ferncroft, is gonna report that, hey, we have, appointment for Wednesday, Thursday, Friday, and we've got nobody 75 up signing for it, so we might have hit the number.
Yeah. And I did have talk with the site manager today about a direct connection with Middleton, since we are a site community, about trying to reach out to us when they feel that they have a void where they're starting to see that transition and the numbers are starting to, like, you might have a day or two where they're getting ready to pivot the state, but they know that they've already reached that percentage, that they could reach out to us and try to, get some message out. That's a political issue. We did talk to the site manager in terms of, every town and all that stuff, but just, they do have vaccine that, once they draw, they have to get rid of.
Yeah.
So if they have no shows or people that, have overdrawn, they got to put that in somebody's arm.
Yeah, we saw that today in the news. About 1,200 doses, unfortunately, was spoiled due to, no waiting list, so to speak. So, Derek, I know that you and the Council on Aging Director, and I know she's here tonight, you've identified what you think is about 2,000 residents that are 65 and older. And while you're working now on shut-ins and some of the group homes, are you also going to be delivering the second shot to those that you're delivering the first, or will they be required to, possibly go elsewhere? Like, are you being provided the vaccine for that as well?
Yes. So the information provided by the state is that if we if we continue to do our 85% percentage each week, and this is a challenge, because I'll explain that in a second. So I just want to make sure I stay on track. That we'll continue to get vaccine each week. And the intent is so I'm developing a Microsoft project timeline right now because we just initiated our first 3 campaigns this weekend, and we're moving to our 4th and 5th on Friday, that I need to create this timeline when the 28 days hit and when we have other phases and groups opening up at the same time. So, but our inclination is that we're going to provide that second dose to, especially, we would call those special populations. We call them individuals requiring additional assistance, such as the senior center, Ferncroft, our Orchard Circle facilities that we've always identified in our emergency planning. We want to get back there for the second dose with them because we know it's a challenge. Once we get into further phasings, we would say that those people can get it anywhere, whenever an opportunity comes up. But we want to come back for the second dose. We've told Orchard Circle, yes, they will be back in 29 days plus, as long as vaccine keeps rolling into our department.
And are you able to, if future vaccine comes from the state to you and not vaccine that would be second dose for individuals that have already gotten their first through you, do you have potential plans, if that comes, of how you're going to deploy that to the non-obvious facilities that you've just talked about, but other groups, whether it's in conjunction with the Council on Aging staff or other groups? I'm hoping that as more volume comes out of manufacturing comes to Massachusetts, that you'll be getting more in addition to just the mega sites.
Yeah, we assume that the increase is going to come in the next, 2 to 3 weeks. But we developed a vaccination plan, the health department, and working with the Tri-Town health departments, we developed a preliminary vaccination plan prior to knowing of the mega site, and then it kind of came out a few days later. We identified certain groups all the way through the phasings that you see through the State Department of Public Health website, and we logistically said, what can we handle with resources, with shared resources, with staff, and based on pooling of available vaccine. There were certain groups we said we can't touch, right? This, like when we go to phase 3 at large, we're going to do a percentage, but it's not going to be like, that's not going to be your first location to go would be the local health department. But certain groups within the phasings we looked at, such as we knew the intimacy and the need to be there for our seniors, right? Just because we always have had that relationship with them for the flu clinics. I always use the flu clinics because if you remember, flu vaccine is always available in like September, right? It's available in Costco, Walgreens, and and CVS, but we sometimes don't get vaccine till middle of October. And we'll still have 330 people show up because they've waited for us to do it as a health department, because we have that, just that intimate feel. Our public health nurses have relationships with most of the seniors because she runs the senior weekly clinics pre-pandemic. So we will continue to roll, but we have identified, for instance, I'll use K through 12. We really want to locally reach our teachers that have been really working hard. I was
going to ask that.
Yeah. I mean, they've been there 5 days a week in the elementary schools, and we know Masco and junior and high school have been working really hard to keep going. We feel like don't push them to a mega site, and I don't say that in a negative way, but we want to be able to reach them as soon as we can get enough vaccine. It's just a game. It's a chess game. Like, will that phase open up And when it opens up, will we have enough vaccine pooled between the 3 towns to do the K through 12? Or will it be like, we don't have enough, we encourage you to go to the mega site, and then we'll have some supplemental clinics following for the teachers that couldn't get there. So it's a moving game, but our inclination is similar to how we do food clinics. We go into the schools. We do not see us going into the schools because there's a wait time related to this vaccine. We see this as an opportunity to like probably talk with our superintendents of both schools and talk about some type of partnership on a maybe an early release on a Friday, not super early, maybe a 1 o'clock, and do it at the Topsfield Fairgrounds and tell the teachers, we're going to do this as a Boxford, Middleton, Topsfield, and then try to reach our teachers if we get enough pooled vaccine to be able to handle, a couple clinics. So there are certain groups we've identified we can handle. There are some that we can't. And we just know that, even when you have certain groups that have comorbidities, we know that, there might be more clinical staff at a large site to be able to assess that, and we wouldn't be able to.
So Derek, I was going to ask, so I expect what's going to happen is when they move to the next step in phase 2, which will be 65 and older, and then the next step after that is comorbidities, teachers, K through 12 staff, and others. I think one of the processes that the state has figured out maybe has not worked well is when they started at the phase 1, which was certain healthcare workers and direct line workers, there was a bit of a surprise of how many chose not to get vaccinated. I mean, we've heard hospitals, for example, some of the hospitals are looking at, upwards of 40%, 35% of the staff have chosen not to get vaccinated. So, I mean, I think it's logical that we will be moving to 65 before there's any clarity that the majority or all of the 75 and older have been vaccinated. And the reason why I'm asking this is as you continue to have small batches of vaccine come in, you're going to try to ensure that certain population groups within steps 1, 2, and 3 of phase 2 are covered before you move into focusing on those. I mean, and I completely agree with what you're saying around the teacher and K through 12, but at some point other of our town employees and folks that are dealing with the public and others as they fold into those phases. So are you going to stay focused on 75 and older and 65 and older before you move into other groups?
That's a great question. I think Jillian and I don't have an answer. I haven't teased that out that far along because, 65 could come tomorrow, and would I be ready to move to 65? Absolutely not. And would I start with 65? Let's just hypothetically say it started tomorrow. No, because we wouldn't have enough vaccine to even hit that group. And we know that we've only initiated, Saturday, getting into homes and getting outreach to the seniors, et cetera. So I would say we would be delayed typically, and the intent would be on purpose because of, except for K through 12, that's a different story. I know that can be very political, but in terms of like 75 and 65s, et cetera, we'd be most likely delayed behind the large vaccination sites, similar to how pharmacies were already putting things in people's arms before we were able to touch the 75-year-old and above to do that. So we would be delayed. We'd be intentional in trying to make sure, with conversation with Jillian, how do you think, are we getting tons of calls still? Do we feel like that, we're getting, a lot of inquiries on the elderly not being able to get it, and then we'd kind of assess it that situational. But I don't think we would pivot the exact next day as soon as the state releases we're going to that. We just don't even have the vaccine, and we're only receiving 100 doses a week. Even when it increases to 300 doses, it's still a small chunk, of vaccine. So I think they know that local health departments are strapped and limited, and they know that they don't want vaccine sitting. It comes frozen. For instance, we get Moderna. We don't have Pfizer because we need extra low cooling for that. But we got Moderna, and Moderna comes frozen and has a shelf life of almost, I believe when it came, it wasn't going to expire till the fall. But once you take it out of the frozen state and goes into our regular cooling, it's 31 days. So they don't want vaccine just sitting either. They want it moving quick. So that's why they don't want to give Middleton or Boxford or Topsfield or all these small towns with small workforces, 1,000 doses, because they just, it's every dose we give is a second dose down the road. So they know that we they want to give us too much that we can't handle.
Okay.
Okay, and I think Jillian, did you have something you wanted to add, or?
Sure. So one of the things that I just unfolded today, so I haven't even had a chance to mention to Derek. Elder Services of the North Shore I used to be North Shore Elder Services. They are trying a pilot program and they invited Middleton to be part of it. And so on Thursday, we found out today on Thursday, they're going to allow us 14 slots for people to get vaccinated. So we've been keeping a list of people who don't have any support to get vaccinated or need transportation. And we're able to complete our list with that vaccination site on Thursday. So we're going to try to see if we can actually get a few more, because I just got an email before this meeting that they have some extras, more than they originally anticipated. So if we can get more than 14 people over there on Thursday, we might be able to get a few more people in. If it goes well, they're going to try to do it on a more regular basis. So we've been working on, as Derek mentioned, a list of strictly 75 plus homebound folks to help with the health department and reaching those people. But with this clinic, we're hoping maybe the folks that just need a ride, we would be able to then, instead of having them be homebound, get them to this clinic, because currently we have 2 time slots, 7 people a slot. So not that we can bring 7 people in the van because that's not safe, but at least we could bring groups of people who don't have transportation, which would make them homebound if they have no family support. In a mega site, us providing transportation to a mega site is a much bigger challenge because you can only do 1 person at a time, because it's nearly impossible, especially right now, to get more than 1 person in a similar time slot, because we've been able to schedule 2 people in the past week, and that's because we had a volunteer refreshing the site constantly until there was a cancellation to get in, because at Danvers they really haven't opened up sites recent or more appointments in this past week. So we are monitoring that, and then with the list that Eileen provided us from the clerk's office, we've been working on narrowing down that 75 plus and checking in to make sure that anybody who is truly homebound is put on a list for Derek and Tracy. Anybody who has absolutely no family support and needs help registering or may potentially need a ride, that we're helping them with that as soon as opportunities open up for us to be able to schedule people. With that said, as I'm sure a lot of you know, that 211 number became live with the state of Massachusetts, and that's been as basically how that works is that when someone calls that, they get somebody who is looking at the same map of Massachusetts that we're all looking at when we're trying to register people. So for some people, they end up on the phone for like an hour until they get to speak to a scheduler. And then there's nothing available in this local area. Like they opened up a bunch of sites, appointments and at Gillette Stadium and a couple other places. But for our seniors to get there, that's just not realistic, especially for 2 shots. So we've been, we're looking like we're in a pretty good place with Elder Services opening this up. I mean, there's still obviously a lot to be done, but I'm trying, the COA team is really trying to take as much off of Derek and Tracy's plate as possible and see what we can do through Elder Services, so that they can stretch what they get a little bit further and, focus on people that there are no other options for. So,
Jillian, where is this site that North Shore is?
it's right at North Shore Elder Services is at 300 Rosewood Drive in Danvers.
Yeah,
So
right over the line. So I assume one of the needs that you're going to try to cobble together if you have 2 7-person slots is some volunteer drivers and other efforts like that will both get them there, wait, and bring them back.
So we're not using volunteers, we're using staff. And we were fortunate to get a grant from Elder Services between June and December that helped us a lot with our drivers, with our payroll for drivers, so that we could kind of build up some hours. So when this time came and we needed to do some extra driving, that we would have that budget in place. So that's where we are now. Our drivers, I mean, you guys know a lot of our drivers, they're super
Oh, yeah.
committed, super passionate, and they're ready and they're being flexible. So yeah, we're in a good place as far as that goes. We're using more our volunteers with helping deliver meals than something like this because it's driving the big van, and we don't typically have volunteers drive our big van. We have staff do that.
Got it.
Just for safety. And I would say probably just that Derek mentioned this too, like a big part of what's going on right now for our seniors is just that support that, you know, it's okay that you didn't get your vaccine in the first 8 days of February. Like there are going to be vaccines available. Like we are here for you. Like we're not forgetting about you. And like Derek mentioned, when he was saying how a lot of people would wait for the local health department to do the shot, I think that's just really speaks to Middleton in general. It's that small town, like family feel, and it feels good to know that your health director is coming in, the one that's doing it for you. So that's, you know, I hear other COAs and the challenges that they have and the struggles they have with working with their health department. And I feel very fortunate because, you know, it's never a struggle. Derek, his team, they're always communicative, and whatever they need, they're, you know, open to having the conversation and working together. We've been working together since day one that the 75 plus became open. And, you know, after seeing what I see with other directors, it's just, I feel very fortunate. Our seniors are very fortunate. The whole town is very fortunate to have such a great health department. So thank you for all you do, Derek. It's really great.
Well, thank you. And it's been a great partnership since you came on board, to really, every time we've asked something of Jillian and Andy over there, Andy Discs at the COA, there's never been, oh, I can't do it. It's just, yep, what do we do? Tell me how to do it and we'll get it done. So thank you guys. I appreciate it. All of you over there. It's definitely taken some burden off our shoulders on some of the things we see as real challenges.
So Jillian, I assume just through the historic work that the Council on Aging has been doing in the senior center over the years, you have a fairly decent line of sight into your members that may need some more support to either sign up for or get to a vaccination appointment. Are you seeing, you know, are you seeing a lot of demand of folks just calling, you know, cold calling you, looking for help, or is most of the work you've been doing kind of the folks that you've traditionally been supporting in other ways?
We've had all types of calls. So we've had people we've never heard from, our regular people that we always hear from. And then we've also heard from families that they're not local. So they were like, we're trying to get mom set up with an appointment, but we're not local and she doesn't have email. Like, how can we get her confirmation to her? So we've been printing stuff out, delivering things to people's homes, like whatever level that they need the help. We have really been through social media, trying to encourage families to reach out to their older loved ones and try to help provide that support, because it's not realistic to think that we could do every step for every person. But with that said, we've provided support for people that have, you know, like even something simple like uploading their insurance card. Some people just had no clue how to do that. So we just talk them through it over the phone or things like that. We've really just, I think a big part of what we've been able to do for people has really just been providing that ear and that calm, it's going to be okay. Like, cause the anxiety is just really high. But I do think through communication just across the town, and with elder services, like a lot of people are being directed to us, which is great because we're trying to be the hub of the information for our seniors. So when they come to us, we can just empower them at wherever they're at and however they need our assistance. So, but like I mentioned before, Eileen provided us a list for everybody who's over 65 and whatever phone number she had. So we took the opportunity to update our database, and we're currently, so our meal drivers, John LeBlanc, he knows like everybody in town because he's lived here forever.
Yeah.
So he's gone through our list. and helped us identify who we know for sure doesn't need help, who he knew for sure would need help, and who we didn't know. And now we're calling all the people we don't know whether or not they need help or not, just so we can make sure that they're all set. So we are trying to be, with the resources we have, very thorough and checking in on everybody, just to be sure that they're not needing anything more.
So I would ask you, Jillian, and I'd say the same thing to Derek. If this is a case as this moves forward and more vaccine comes in, or more folks are reaching out to you in your office, Jillian, that are frustrated and can't get, can't get an appointment, not because there's not vaccine available, but because they're unable to get through a very complex process that the state has set up. If you are realizing that you are reaching a shortage of resources to help you get that done, I know neither one of you will be shy to speak up, but make sure you do. While there are CARES Act dollars, this is regardless of what we have in our CARES Act account. I think this is an all hands on deck priority for the town to ensure that our residents are getting as fair of a shake in a process that has not gone well across the state. And if it's a resource issue that we can help solve that way, just be vocal about it.
Okay.
Appreciate that. I'll just finish with tomorrow. So I run a weekly local health director call for all the North Shore health directors. We've been doing it since the pandemic started, about 35 of us, from all the way from Reading to Gloucester. We have partnered with the Essex Technical High School right here in Middleton, Danvers, in the video and film department. They're going to tomorrow afternoon be going on site with me and some other local area health directors from Beverly and Gloucester and Danvers, and we're going to be creating a orientation video for the public on what the large vaccination site looks like, what to do when you arrive, where you go through, what door, frequently asked questions we've put together. We have had the site manager from the vaccination site look it over and provide some feedback and give us some tips. And our one and only George Demerit from our Board of Health has an appointment tomorrow there to get vaccinated. So we're going to shadow him, and he's going to be our star, nominated for a Golden Globe next year for this video. But so we're going to release this on the North Shore so people understand and try to take away that fear of when they hear mega site or they hear something, to know that it's a lot smoother than what, and don't be intimidated by it. And if you can get a spot, go to it, versus just trying to not get vaccinated because you're afraid. So we're going to be putting that out in probably a week to 2 weeks, as soon as the tech can edit it and get everything done.
You couldn't have picked a better guy than George.
Yeah, he's great.
That is actually going to be great, Derek. So I was very lucky in the first week when slots opened up. I was able to get my mother an appointment up at the mega site. So if she's watching this, she's probably upset that I just let everybody know she's over 75. But I will tell you, we went in not knowing what to expect. It was great to pull into the parking lot and see two of Middleton's finest serving as a detail with traffic, but the process was so, I would say, easy. The staff there were really helpful. They were very kind. There was a lot of questions. There were a lot of people that were coming in with family members. There was very little confusion. And I think the biggest thing that folks just need to know is when you get in there and after you get the shot, you're going to wait 15 minutes. There will be a doctor that will be circulating around, asking questions, making sure that you're not having any side effects. There's a significant medical team there on campus should that happen. And then you get into a very small, very quick moving line where you schedule your second appointment. And when you arrive home, your email has your appointment all scheduled, and you bring that paper back with you in 4 weeks. So I will tell you that the mega site process, once you were able to get scheduled, is really easy. But I will tell you, my mother spent most of the week after her appointment answering questions from friends that have appointments of what it's going to be like. And I think this video will go a long way to allaying fears of what the process is going to be like.
Great. Thanks, everybody.
Thank you, guys.
This was helpful. Thank you.
Definitely. We all know the job you guys do. So when people ask me, I try to let them know. So
Thanks.
thank you very much.
Yeah, I mean, a big shout out to you, Derek and Jillian, and all of your staff for not just what's been happening since this vaccine process has started, but really since the beginning. I mean, Jillian, you and your staff pivoted from an open door policy at a very growing and active senior center to delivering services directly to people's homes and ensuring those that were the most fragile and in need were being served. I love watching on social media, John and his team delivering mails. I saw our good friend Rick Cassiotis helping out a couple of times too, looking good out there. But that was phenomenal. And then Derek, I said this to you on Saturday in our budget hearing. I mean, I think across social media, people wait in anticipation to see your weekly reports. In some cases, it's people pour through them, but it's not just numbers you're providing. It's tips, it's knowledge bases, what to do. You know, everything that you provided around Halloween and Thanksgiving and the Christmas holidays of how to prepare and how to stay safe. I think has allowed folks in Middleton to really have a good line of sight to the work that you both are doing and your staff. So I just want to say a big thank you for all of that. It's, we've had to adapt, all of us have, and you guys have led the way. So in your department. So thank you for that.
Well, we appreciate that. Thank you very much.
Great. Good job.
All right.
Okay. So if that's all there is on that topic, then we'll move on to number 4, which is an update and discussion on the special town meeting that was originally scheduled for January 28th and continued to February 25th. I'm not sure if Barbara wants to speak on this first, or is it Andy? I'm not sure.
Up to you, Andrew.
I'll give the lead in for Barbara and then I'll quickly turn it over. So
He likes to do that.
here's Barbara.
Andrew. As you may recall at the last meeting when we discussed this, I mentioned that as based on the statutory authority that's given to moderators, we can only recess and continue a meeting for 30 days. So I had continued the special meeting until February 25th. And also at that meeting, we discussed that it was going to be highly unlikely that we would be able to hold a meeting on February 25th. And my sense was that I would be going forward after today's meeting with the submission of a new declaration, recessing the meeting and continuing it from February 25th to March 25th, unless you all have changed your position.
No, I think, that's the wisest course of action.
I concur.
Yeah, I agree as well.
Okay.
It'll be my
what-
intention then to file the declaration tomorrow. And the meeting then would be continued until March 25th, at which point, a couple of weeks prior, we'll revisit it again.
Very good.
So Barbara and Andy, one of the questions I had is during our budget session on Saturday, something actually came to my attention when Masconomet was giving their budget presentation. They talked about 2 large tents that are being put up at the school. One of them in anticipation of graduation on the field, and another one that is going to be out in the other field for the band and other groups that have been practicing and will be using that site when the weather improves. As we move closer to whether it's a special town meeting or moving towards our annual town meeting, I know there's been a lot of discussion, Andy, about where that could potentially be. And while we had talked at one point of, maybe the big ballroom at the hotel may work, obviously that's a vaccination center now. The reality is I'm not sure if the emergency orders that are in place would allow us to actually hold a town meeting outside of the confines of the town. Normally, you would need
Right.
approval to do so, and if so, should we be looking at that?
We've already have permission to hold it outside of town borders.
Borders, okay.
Yes. I think that was put in when North Shore Tech was phasing out in Middleton, and
Yeah.
we thought that there might be a need to go outside of town. So we do have
And
that.
the thinking was the Masco Auditorium at that point.
Yeah. So we do have that opportunity if we need it.
Okay, okay.
So, and actually that's a nice segue into the next item on the agenda, which is the annual town meeting. And Barbara and Eileen and I have been talking about alternative venues and alternative dates for town meeting. And I know at one point since I've been here, it came up in the past about meeting at Masco. And at that time, and that was really just because of space concerns. And at that time, the preference was to stay in town. Obviously, that's always the preference is to stay in town. But we are exploring alternative locations and alternative days of the week. We typically hold town meeting on Tuesday, annual town meeting on Tuesday. Especially if we're going to be outdoors, a Saturday would seem to be, or a weekend day would seem to be a better option than 7 o'clock on a weeknight. So if there's any feedback from the board in that regard, would certainly welcome it. We haven't had any conversations with Masco. I would assume that Boxford and Topsfield will probably be looking at also having town meeting at Masco, but I shouldn't speak for them.
That's where Boxford did theirs last year outside at
Yeah.
Masco.
Yeah,
Also-
Boxford always has their town meeting at Masco.
Yeah, just
And-
not outside.
Yeah, and Topsfield had theirs outside at Masco, this past May or June, whenever they had it. So if we are going to look at doing it outside under a Masco tent, I think we need to talk with the superintendent sooner rather than later to make sure it can be fit in with the requests of the other two towns and all the Masco activities.
Agree.
Good. All right.
Yeah, so we'll certainly initiate those conversations with Dr. Harvey. And so, tentatively, it would be, if we were to stay roughly in the same schedule, it would be May 15th for town meeting if we just did the next Saturday. But again, we don't know what's happening over at Masco, what the other conflicts are. So we'll start that now. Barbara, was there anything else on the annual you wanted to talk about?
No, I agree that it makes sense to start planning this as soon as possible, because obviously if we're going to transition to an outdoor venue, that's going to be very different than how we've held meetings in the past, and it takes a lot of planning. We're going to need different types of equipment, different types of setup from the town clerk's office, and just a whole different type of plan. So the sooner we know how we're going to do it, the better.
Okay. Yeah, there's plenty of logistics to work through, so.
It will be an endeavor for sure.
Yeah.
And Andy, that would also impact on the town election potentially, right? The date.
It could, yeah, and we've been, Eileen and I have been talking about that as well, and we've been trying to stay, trying to stay out of the schools to the extent that we can during the week at least, and so one thought we had was having it on a Saturday at the school, and that way we wouldn't be bringing in outside bodies into the school during the week if we did it over the weekend. So we'll continue to talk about that and have additional conversations with the school about that as well.
So Andy, one of the questions I'd ask is, should and I know May is a long way off, and we could be in a much different and hopefully much better place by then. But if the usual date for the annual town meeting does not end up being the date, we are potentially going to be dealt with, depending on activity at town meeting. We may have a vote that occurs at the town election to validate and approve for a project at the golf course. And you know, moving town meeting is one issue. Moving a town election also has ramifications too, that obviously Eileen is very clear on, because she's had to move multiple elections, or at least processes over the last year of this pandemic. So, you know, I think just being prepared to, if we're shifting everything, a town meeting shift also is going to mean an election shift.
Yeah, certainly. And you know, so one of the, you know, as Barbara mentioned, there's plenty of logistical issues to deal with for moving a town meeting or having a town meeting outdoors. We're also dealing with 2 different school districts, so that compounds the logistical challenges. But, you know, we're fortunate we have a really good working relationship with our local schools. We have a really good relationship with Masco. So I'm confident that we can figure out something. It would be my personal preference to have the town meeting before the election, no matter how things fall, whatever the dates happen to be, because of the facilities project on the town meeting and on the election. It would be preferable to do the town meeting first, so that we can give the full presentation and answer any questions in public, in a very public forum that come up, and then have the election after that. I will, just not to get too far off track, the Master Development Planning Committee is finalizing its presentation and has begun to reach out to neighborhood groups and business groups and others to set up times to start to talk about that. So that's going to be something that they are very busy with over the next 3 months or so, trying to get the word out on that project, answer any questions that there are, and build support towards that. So that'll be happening, and yeah, we'll do our best to keep the two events proximate to each other, and that's been kind of the approach the whole way along.
All right. Well, thank you very much.
One other thing, if I could, Mr. Chairman, I mentioned in my email to the board last night with the meeting packet, there was some concern on the part of some board members about the private well bylaw, and I'm always reluctant to come forth with an article if there's not support from the board, and so I don't mean to put the board members on the spot, but if there's not support for the private well bylaw, I'd rather know that sooner than later, so that we can explore alternative avenues if alternative avenues exist.
I think everybody knows where I am.
Yeah, I think regardless whether you're for or against it, I think this is a bad time to present it. I mean, even if we think we presented, I think you presented at a later meeting. I don't think this meeting, with everything that's going on, is the appropriate time for that.
Yep. I would agree with that, Tim. I mean, I have my stance as well, but I would agree with this. Now's not the time.
I mean, you know, if it's not now, how does that handicap our water withdrawal permit process?
Well, it certainly doesn't help in getting an increase in our withdrawal limits.
You know, is there a time limit? So if it's not this annual meeting, if there's a subsequent special, how does that timing work? Or if it's the next annual meeting, how does that timing fit in?
The longer it delays, the worse it plays for us. So we had, a year ago is a long time ago, but leading up to the annual town meeting last year, we had made the commitment to DEP that we would bring the bylaw forward. And that is necessary in order to renew our Water Management Act withdrawal permit and hopefully get an increase in the amount of water that we can withdraw. We're up against, as we've talked about for a number of years, we're up against our ceiling in terms of our water withdrawals. We were hoping and we were trying to position ourselves to be able to withdraw more water. And one of the ways that we would have been able to argue in favor of that is if we had the private well bylaw in effect, along with other things. It's not the only thing, but it is the one that gives us the most benefit in DEP's eyes. The fact that it was there in the past and then it was subsequently repealed, I think is, they understand the local politics, and I'm sure they see it in other places as well. And, but it, it doesn't help us. I can't tell you that, we're ready to file for our renewal. And so a 6-month delay to the fall probably means that we will not get an increase in our water withdrawal rates.
Andy, has DEP, I know we talked about this previously, now that the golf course is in our possession and the amount of watering that was occurring there. I assume, albeit it was a private well, but it was a certain size well that needed to be registered and such. So I think there's some logical proof that we could provide to DEP that the lack of watering 18 holes on a daily basis is, regardless of whatever the water withdrawal status was in the town, should have a positive effect on those numbers.
Yeah, we would expect so. What I haven't been able to find out is what that registered withdrawal amount is. And so I would say the most that we would get would be whatever that withdrawal amount is. We're working with a consulting engineering company to help us through this. They're trying to research that and figure out what the withdrawal amount was. But you're right, Brian, that certainly will help us. And the engineers at Wright Pierce have weighed in, and it's their opinion that it will help us. But
Well,
DEP wants to see a sort of global approach to water use. They don't want to give us more if, in their estimation, we're just running it down the drain somewhere else.
yeah, but here's my position on it. If I'm in favor of this bylaw, I want an educational program to go out. I need a lot of people to know about it. I need a concerted effort. And in the next 3 months, 4 months, that's not going to happen.
Mm-hmm.
So the question becomes, do you want to come before them and say we have a delay? Or do you want to come before them and say we've had a defeat? I think it's the same result.
Mm-hmm.
Well,
Okay.
I think the sentiment is clear as far as this annual town meeting, so I don't think we need to keep discussing it.
Right.
Andy, the other thing that you had asked about was the making the bylaws gender neutral, which, I think is, a good idea, and we should, move forward with that.
Yeah.
Yeah.
I assume that was going to happen simultaneously to any of our charter work. That would be one of the areas that would, so is it something that needs to be done at this town meeting or done when we are adopting a new charter and kind of doing it all at once? Because I'm also thinking about, I would hope not, but I would expect that would be an item that there's probably going to be some debate at a town meeting. I don't know why, but there will be. So I'm also thinking about, our fall special town meeting that didn't occur, which we had a bunch of items there, the special town meeting that is required due to the signatures, what is becoming a pretty full agenda for our annual town meeting, and then add to that what could be a full night of discussion around the future building projects at the golf course is all at the same time that we're wondering when and how we could hold this town meeting with a pretty full agenda. So I don't have a problem. I actually think having a gender neutral bylaws makes sense. I think we need to, include that same mindset as we talk about our future charter revamp, but I just don't know if it makes sense to do that now in terms of timing, in terms of
So,
a full agenda during COVID.
yeah, right. And that's a good point. We were able to find an example of another community that did this for its bylaws. It didn't have to go, chapter by chapter. It was just a blanket where it says he, it shall be replaced with he/she and language like that. The reason that I suggested putting it on this meeting is that we're likely to do a revision, an update to the municipal code this year after July 1st. And so there'll be a fair amount of just editing that goes along with that. And so it seemed to be an opportunity to do that before we did the overhaul, or I shouldn't say overhaul, but the revision of the code. I think the charter is going to take a little bit longer. If we appropriate funds in May or whenever we have annual town meeting, those funds wouldn't be available till July. Always hard to get a project like that off the ground in the summer. So I would guess that the earliest we would be back with a charter revision would be annual town meeting of 2022. So, and Eileen, I don't know if you want to weigh in on the general code piece of it. I know you've got plans to do an update, but I don't know how quickly you plan to do that.
So I have a supplement pending. I was sort of holding off to see what was going to happen because it's just, it's time consuming collecting all the books just to get it up to date. But my thought is that we haven't recodified in a long, long time. And I just see a lot of stuff that needs to be cleaned up, and general code's really looking to do that. We pay them an annual maintenance. We really should be utilizing the service a lot more than we do. We anticipate some zoning coming, and so I'm just waiting. I feel like we're waiting, but I would like to go in and do some work, probably, and I may do it. I'm not sure if it makes sense to do it before the town meeting when, we could potentially have a lot. That would be a big supplement if everything that's on the warrant goes through. So I have to decide, but I definitely think it's time to recodify. And that's some money, but it may be the time when they're recodifying to make those wording changes. Because they're doing it. This is something a lot of cities and towns are doing. Well, towns. So I am hearing about it. So I'd like to get that cleaned up.
We can, I think on the next meeting where the board is scheduled to close the warrant. And so at that point, what we would normally do is take a quick run through it. And if there are things you want to pull off, you can pull them off. And if you want to chew on it for a couple of weeks, we could do it that way, address it at the next meeting when we close the warrant and start to button that up.
Okay. All right. Before I move on here, I wanted to ask Barbara, the continuance for the special, was there a date or are you going to arrive to that tomorrow?
March 25th.
It was 25. Thank you very much. From my notes. Okay. All right. Thank you. Thank you, Eileen, too. Okay. So on to number 6 is going to be a review and vote to set the fiscal year 21 sewer rate for the South Essex Sewer District at 2.099 per 100 cubic feet.
I would make such a motion.
Second,
Second, a motion and a second. If I could ask Mr. Hooton to give us a roll call vote, please.
Mr. Pentakis,
yes.
Mr. Crespi,
Yes.
Mr. Cassiotis,
Yes.
and myself. Yes.
All right, motion passes unanimously. Thank you. On to the next item will be to a vote to appoint members to the town's creation of a town's Rails to Trail Committee with terms as noted. Following members would be basically they're members of the existing Middleton Rail Trail Alliance in town. Been working on putting the rail trail together. Those individuals would be Charles Costigan and Martin Emmerich through a date of June 30th, 2024. Richard Gilman and myself, Rick Cassiotis, for a term through June 30th, 2023. And John LeBlanc and Sherry Armitage for a term through June 30th, 2022.
I would make such a motion, Mr. Chairman.
Second,
Motion and second. Okay, Tim, if we could have a vote.
Okay. Mr. Pentakis,
yes.
Mr. Crespi,
Yes.
Mr. Cassiotis abstaining,
Yep.
and Mr. Hooton, yes.
Okay, motion passes unanimously. I wanted to give it just a quick update on that. We've, through the help of Town Planner Katrina O'Leary, we have submitted 2 separate grants back in February, and the end of this month will be, we'll find out if we were awarded the grant that will continue phase 2, which is from Central Street to Maple Street, excuse me. And then an additional grant separate for that we put in would be awarded in July. And that's the section where we would be including a portion of the rail trail, which is a pedestrian footbridge to go over Ipswich River that would be included in the design of the state's replacement of the Maple Street Route 62 bridge. So I just wanted to give you an update on that or where we were. And nice to see everybody using that down there. It really is. Okay. So that motion passed unanimously. All right, now we'll move on to a vote to accept a donation from Susan and John Muzzychuk in the amount of $500 to the Middleton Food Pantry.
I move we accept with thanks.
Second,
Motion and a second. Tim, if you would call a roll, please.
Mr. Pentakis,
yes.
Mr. Crespi,
Yes.
Mr. Cassiotis,
Yes.
and myself, yes.
All right, motion passed unanimously. And again, as Brian mentioned, with thanks to Susan and John Muzzychuk. Okay, closing it out here, we're going to get a review of where the CARES Act reimbursements are at this time.
And really, Mr. Chairman, this was in response to the request from Brian at the last meeting for a breakdown of what we've spent CARES Act funding on. We received, I don't have the exact number in front of me, about $890,000 in CARES Act funding originally back in March of 2020. The first round, which was in June, was a very small round for us, about 30 or 33,000, I think. The lion's share of that we were expecting FEMA to pick up. FEMA subsequently said, we're not going to pick up as much as we said we were going to pick up. And so some of that flipped over to CARES Act. And then we did submitted another round of applications for CARES Act funding in October, and then a further round in December. So far, we're up to $494,000. Obviously, with the pandemic nurse, that's ongoing. There'll be costs, no doubt, with respect to local vaccination work that we do, mostly in the area of labor or potentially materials, but not the vaccines themselves, or a venue if we needed to rent a venue in order to do a vaccine clinic or something like that. The PPE stuff, the cleaning supplies, that's tapered off quite a bit. We're continuing to get some grant money here and there. I know that the Rotary is giving a donation to the fire department for PPE sometime soon, actually this week. So we still get money trickling in there. And so we feel like we're in good shape. We just don't know what's coming down the pike. Whether there's school related expenses coming or, something more along the lines of vaccines. And then if we're changing venue for town meeting and town election, and we're still able to put those costs in for reimbursement, those would go in under CARES as well.
Yeah, Andy, the 494 includes the 90 Masco allocation?
I believe that's in there, Costa.
Okay.
Yes, it is.
Okay.
Yep.
So
That's on the last page.
So part of why I had requested this was around the conversation we just had with Derek and Jillian, and while we're seeing small chunks of vaccine that are coming into the town's Department of Public Health, I expect as the volume of vaccine is manufactured, I mean, just Pfizer this week announced that they can cut the production time almost in half by some of the activities, plus the the Defense Construction Act that the government has implemented to allow a lot of these supplies to be brought to the two drug manufacturers to allow a faster delivery. I want to make sure that we have available to us. What I don't want to have is the potential for us to get vaccine but not have a budget to support that. Secondly, I want some clear line of sight, and as the budget process is moving for both our elementary schools and Masco, and I know that we in Boxford had supported Masco earlier in the year through some of our CARES Act dollars, but as we heard Saturday, I know Masco just got about 600,000 plus another 100,000 in the last week, and grant dollars that have come to support them for COVID related. And obviously Congress may actually do something again on dollars that will likely go to the states, maybe not so much to cities and towns, but states that will then be parceled out. So I want to make sure that the dollars that we have available at the end can support what might be some late breaking activities for us to really help our residents. Not just those are 75 over now, but as we get into 65 and older, and then when we get to phase 3, which is really the entire population, there's probably going to be a pretty dramatic scramble for vaccine. And then, I appreciate what you said about the PPE that's coming to our police and fire from the Rotary, which is pretty amazing. But, we may not be in the position like we thought we're going to be in last year of dollars that weren't spent maybe being returned. I'm not looking to spend for the sense of spending, but this may be it in the amount of money that we're getting. And we may have opportunity to have an effect on vaccines. So I just wanted to get a little line of sight. This was actually really helpful to me. And I think this kind of shows that while this was a pretty dramatic hit to our operations and our budget, the CARES Act dollars was a godsend. And it would have put us and other cities and towns in a position of having to actually mid-fiscal year go in and dramatically cut budgets, and which would have probably meant layoffs. $850,000, if we took that out of our budget right now, it would mean layoffs. So, I appreciate that. So again, the amount that's remaining is about how much, Andy?
400,000.
400,000.
Okay. So
it's probably, in all honesty, it's probably a little less than that because of the lag in processing payroll and invoices and things like that.
Okay, understood. So I'd just like to continue to hear as the process moves on potential, I know we just got 100 doses of vaccine, but if those numbers double or triple going forward, I think Derek will be in the position of not just, going to people's homes that are homebound. We're probably looking at a vaccine clinic that's going to happen. And I know this isn't going to be like a flu vaccine, people are waiting 15 minutes afterwards to be watched. This isn't 2 nurses and a couple of volunteers. There'll be a lot of health professionals there. And this may be a case where our community steps up, that we have those in the town that may want to be able to help and operate in doing that. But I just want to make sure that those resources are there.
Yeah, and that's, that's a good point that, we've got volunteers that we know have signed up through the Medical Reserve Corps.
Yep.
Depending on what a particular vaccination clinic looks like, that might be enough. That pool of volunteers might be enough. It may be just a drop in the bucket of what we really need, depending on what the numbers are that we're going to try to vaccinate. So with respect to the CARES Act, I've mentioned it before. I'll mention it again. The CARES Act funding and the reimbursements and all of that has all been managed by Sarah Wood. So in addition to all of her normal budget stuff and putting together the GFOA budget document that you saw on Saturday, she's also been managing the COVID CARES funding too. So just want to give a shout out where it's deserved, and it's certainly deserved there.
Yeah, surely. Thank you. Thank you to her too. Thank you for this report. I appreciate it.
Sure. Yeah, if any time you want an update, let me know and we can do that.
Okay.
Rick, you're muted.
You're muted.
We discussed a couple things that were off agenda, but I'm not aware if there's any new business for us to discuss. If not, we'll make a mention of the upcoming meetings. The regular Board of Selectmen meeting will be February 23rd. We have our capital budget summit coming up on March 6th, and then resume at regular Boston Board of Selectmen meetings March 9th and 23rd. If there is nothing else, I guess.
Actually, Andy, our next meeting is the 23rd, which will be the last regularly scheduled meeting before Chief DG retires.
Correct.
And normally this is where he would come into one of our meetings, and we would present him with both a gift and have an opportunity individually and collectively to thank him. Well, we're obviously not going to be able to do that in person, but if we might be able to, if his schedule will allow, on the 23rd, I think we should spend some of our agenda time.
Sure.
Both giving him an opportunity to talk about the great things he's done during his tenure, but also give us the opportunity to do the same thing as well.
Agreed. Excellent. Okay, then if that's all, I'll take a
Motion to adjourn.
Thank you, Mr. Hooton. All right. Granted. Good night, guys. Thank you.
Thank
Good
you.
night.